angiomas, also known as cavernomas, and abbreviated into cranial cavernous malformations, happen in the brain. These malformations have thin wall structures and lack elasticity. They can rupture and leak easily. CCMs are described as raspberry in structure because of their bubbles. These bubbles are called caverns, and they're created when capillaries fill with blood. These are the arteries and these are the veins. In between are the capillaries where the malformations happen. Cavernomas can be caused by a mutation of genes. This type of cavernoma is called familial. 20% of these are an autosomal dominant disease, which means they happen in every generation. Cavernomas can also be genetic and don't pertain to males or females. One copy of the mutated gene means you have the disease. This disease can be diagnosed if the patient has seizures, neurological loss, or brain scan for any other medical reasons. The symptoms, type, and harshness has to do with the location of the cavernoma. Symptoms include headaches, seizures, neurological loss, which means problems with memory, attention, vision, and limbs. If there is hemorrhage, it means there is bleeding in the brain, and this can affect the tissue. This can appear as stroke-like symptoms. The only prescribed medication can be for seizures and headaches, not for the disease itself. The #1 treatment is to watch and wait for bleeding and for more cavernomas to appear. The only permanent cure is surgery, and it involves an incision in the head plus the removal of the cavernoma. Treatment is established according to these factors. 1. Bleeding, the amount and frequency. If it's slow bleeding, the body can absorb the blood back. 2. The number of cavernomas. The more there are, there's a risk of hemorrhage. 3. The location. Some areas of the brain are more sensitive than others. A study made by the Department of Neurosurgery from the University of Michigan states that the prevalence of the cavernomas increases with advancing of age. There were 164 cavernomas identified in 14,936 patients studied. There were ages 25 and under. The prognosis is not conclusive, variable even, because there are many factors: location, size, and number of cavernomas. These determine the severity of the disorder. Fun fact, some doctors have conducted studies saying the genes correlated with the disease are responsible for the maintenance of blood vessels.